Hey folks, Doc Parsley here. Going to instill my daily sphincter tone reducer. By that I mean I'm basically getting out of bed every day with the idea of trying to help a few people get through this in a better fashion. And what I've promised to do is just bring some rational conversation to this. And by rational, I just mean that we are considering a lot of alternatives and we're being rational. Here in Texas, we still aren't locked down. Just got back from my old man walk. A little sweaty and unkept. Hopefully you guys don't mind. But I'm just going to do a broad one to this morning. I'll touch on a few headlines. And I'll probably reinforce this concept probably every morning and spend more time on the headlines and less on the concept. But let's start here by sharing my screen. And here we go. So if you have not seen the site, it is Worldometer, so worldometer.com. Total number of coronaviruses worldwide is 955,000. Or is it? Yes, this is the total number of people that we have on record who have been infected with coronavirus at some point in their lifetime. I am not blaming Worldometer, they're just giving data. However, the media likes to talk about this number right here. Social media specifically likes to talk about these numbers right here. 955,000 people ever. We do not keep track of who has had the flu ever. What we keep track of is how many people have died. This is a substantial number. It is not an overwhelming number worldwide out of millions and millions of people. And we'll talk about how many millions, maybe on a later one today or tomorrow, how many people have recovered. So here are the active number of cases, 703,000. 703,000, that is a lot, but as you'll notice, it is significantly less, almost a quarter less than almost a million up there. But the more important numbers, which get almost no attention, is that 95% of these are mild. 95% of 700,000 are mild. Mild meaning they don't need medical care. 5% are serious or critical, meaning they might need medical care. They're either in extremis, or they look like they could be heading that way, or they're just in a really high risk category. Now, follow this with me. This 5% out of 700,000 will go into this category of either recovered or deaths. So we're worried about this 5% becoming this percentage. And this percentage is roughly 20% of that 5%. Meaning 1 out of 5 people in this category will die or succumb to the disease, as the euphemism is now being spread. So let's summarize what we've just talked about here. There aren't a million cases of coronavirus. There have been a recorded number of that many positive tests or something close to that. We have 700,000 active cases, of which 95% are mild and don't need medical attention. 5% may need or do need medical attention. And 20% of that 5%, or 1 out of 5, those people are likely to die. Another way of saying this is that 99% of people will be fine if they get this disease. And that is not even accurate, because what is more accurate is that a significant portion of people in a certain category, a certain age group, a certain demographic, a certain immune system, certain disease state. So basically, the healthier you are, the more likely you are to be in the mild condition, and the younger you are, the more likely you are to be in the mild condition. And the media and social media is all talking about the 1-2 obscure cases that they know of. And I'm not saying this is only 1 or 2. There are probably thousands of people who don't fit the demographic who have died from this. There could be underlying explanations as far as their physiology, but it could also be that the total viral load, the amount that they get into them, is so high that it overwhelms the body before their very confident immune system can get there. This would likely be the case of these healthcare workers who are going into this every day and exposing themselves to this virus every single day, and multiple times per day. So those people are likely to get more of that viral load in them. And you hear a lot of stories about healthcare workers, young 40-year-old ER doctors who are in good shape, who are going on ventilators and maybe even dying. So I'm not saying that's not happening, but when you hear hoofs, you look for horses. You don't look for zebras, at least in America, right? Not a lot of zebras running around, a lot of horses running around. So let's pay attention to the more important thing. A metaphor that I'll throw out there, and I'm not trying to be glib, it's just a simple metaphor that we can all visualize. If this were automobile accidents, okay, which it could be, right? If you look worldwide, more people than this die from traffic accidents. I say traffic accidents, not automobile, and misspoke. So traffic accidents. And we said, oh my gosh, there are this many deaths from traffic accidents. Everybody is at this risk of death. This is what we call the absolute risk. The entire population, if we divide the total deaths over the entire population, that would be the absolute risk. In this case, we're calling the total population the total number of people who have ever had the disease. But if we said automobile accidents to be the total, or traffic accidents, the total number of people that use the highway systems and drive in traffic. So almost the whole world. Would everybody have the equal chance of dying? No. The Tibetan monks have almost no chance of a traffic accident death. The 20-year-old on his cafe racer who's been drinking and popping wheelies down the freeway at 100 miles an hour has a significantly higher risk of death than the 65-year-old grandmother driving her Buick to the grocery store. So all risk is not equal. This, it's unpopular to say, but this category of serious or critical, that's not equal. It's not equal. Not everybody has a 95% chance of being mild and a 5% chance of being critical. That's not true. And no statistician or epidemiologist would tell you that that is true. That's not true. It's not absolute. There are relative risks. If you are under 9 or 10 years old, you have a 0% chance of being in here. And 0% doesn't mean 0 cases, right? You could have 10 people, and the media will definitely cover those 10 people worldwide that were 10 years old or 8 years old or 6 years old or 3 or whatever. They'll cover those, guaranteed. You'll hear about every single one of them. But they are the exceptions to the rule, right? They are newsworthy because they're exceptions to the rule. This 5%, have no doubt about it. Let's not lie to ourselves. Let's be intellectually honest here. This 5% is by and large vastly made up of people who are more likely to succumb from any disease, any influenza-like illness, H1N1, influenza A, influenza B, killing 30 to 60 to 60,000 Americans every year. Not everybody has the same risk of dying from influenza, do they? Not, so let's be honest about it. Unfortunately, this is elderly and the infirm, people who have other medical conditions or people who are currently in a disease state. And then if you go to a hospital and you're in a disease state and the hospital is crammed with people with coronavirus, you have a much better chance of getting coronavirus and dying with coronavirus or maybe from coronavirus. Either way, you will be a corona case. So this is serious. Let's do what we can. We are already doing what we can. If you look at yesterday's video, I talked about the CDC's pandemic guidelines. I'll throw that up again over the period of time I'm doing these. Basically, there are 5 different categories of pandemic response as far as what we call the non-pharmacological interventions, things like washing your hands and wearing gloves and wearing masks and social distancing and self-isolating if you're sick and closing down school systems and closing down businesses and changing the way people do business. All of those things are recommended at different states of pandemic. We are operating as though this is category 5, which is the highest category. And we are operating that way because we don't know. We have no idea. If we had no idea where the super tornado or the super hurricane was coming from or where it was going to go, everybody would be on lockdown, everybody would be on panic, and this was going to be the biggest hurricane ever in the history of man. And it might be and it might not be. I'm not saying that this is going away tomorrow. I'm not saying that this is going to be insignificant. There's a chance it's nowhere near as significant as we fear it is, and there's a chance that it's more significant than we fear it is. But either way, we're doing what we can do. Non-pharmacological interventions are what the people can do. And the people are going to be the ones that turn the tide on this, and the people are going to be the ones who bear the brunt of this. The healthcare workers do the other stuff, the medical interventions, right? They change the way they test. They change the treatment protocols. They change their algorithms for admitting people. They develop triage if that's what needs to happen. There are things that other people can do, but you as an individual sitting at home worried about this is not helping the case. You need to do what you can do, and you need to take care of yourself so that you come out of this as healthy as possible, meaning that your entire community that you're related to, they will come out of it as healthy as possible if everybody takes care of themselves and takes care of each other. And we can keep moving and move through this as quickly as possible. And I don't know exactly what that looks like. Nobody knows. The experts don't know. The experts model tomorrow off of what happened yesterday. And the more yesterdays we have to add into there, the better we can model tomorrow. But right now, we don't have very many yesterdays. Right now, we just don't have very much information. So in the absence of being able to say this is the likely outcome, we say this is the potential outcome, that all of these people could die based off of what we've seen. If this virus keeps doing what it did yesterday, or the last 3 days we've tracked this, or the last 10 days we've tracked this, here's the pattern. Here's how rapidly it grows. Here's how rapidly the death toll is increasing. If this trend keeps going for whatever amount of time, we're going to have this number of deaths. Now, the one thing that we know is that the trend won't keep going. It will change. Things will change. Might get better, might get worse. We don't know, but it's definitely going to change. The one thing we know for sure is that it's going to change. So nobody knows the future. Prepare yourself in the sense that you take care of yourself. You sleep, you get exercise, you manage your stress, and you eat nutritious food. And I'm going to be interviewing lots of people, giving you ideas on how to do that. But real quickly, look at this. Oh, this is what I was talking about, the CDC guidelines. We'll flip through that real quickly. There are the categories based on how many expected deaths. This is an influenza pandemic chart. The numbers would be slightly different if we knew how infectious this is. Basically, there's something called an R naught. If I get it, how likely am I to give it to somebody else? And also, like, how easy is it essentially to spread? Is it airborne? That's easy. Or is it something that has to be touched? Does it have to be an exchange of bodily fluids like HIV or something that, that's not as infectious? I'm not at risk of getting HIV by being in a room with somebody with HIV. I'm at risk of getting coronavirus if I'm sitting next to somebody who has coronavirus. So how infectious it is matters. But let's say that it's in the neighborhood of flu, and this is how the categories are stratified, 1 through 5. This is expecting roughly 2 million, greater than 2 million deaths, and this is 1 million to 2 million, and this is 500,000 to 1 million. And category 1 down here, this would be like a really bad flu season. 60, 70,000 deaths would be a bad flu season, but that'd be category 1. And then what we would do, here are all the NPIs. The voluntary isolation, the voluntary quarantine, social distancing, workplace, all of that stuff. All this stuff, as you can see, the only thing recommended is to stay home if you're sick in category 1. And then category 2 has that recommended and some more specific considerations, but the only recommendation, again, is staying home. And categories 4 and 5, everything is recommended. Categories 4 and 5, if you'll remember, are 1 million to greater than 2 million deaths. So we are behaving as though this is as bad as it could possibly be. And we are bombarded by headlines that say record 6.6 million file for unemployment benefits. This has shattered the record, which was already the record when 3 million people did it. Okay, so if the record were 3 million and then 6 million, yes, that's it shattered the record. That's an emotionally charged word. Let's look for emotionally charged words. The news should be reporting the facts. This is what happened. Here's what we know about what happens. Here's what we're looking into. That's what the news is supposed to be. Emotionally charged words are deliberate attempts to manipulate you. The death toll, that's sort of an inflammatory way to say that, but we'll give them, we won't beat up on them too bad. Like ER doctor dies, right? ER doctor dies, and like just said, like probably a fairly young, fairly healthy person, and that's going to be presented every single time. Faces colossal test. This is a colossal test, right? I heard someone reported the president seems scared. I'd be a little concerned if the president wasn't scared, but I don't think harping on your leader's fears is the way to get through a time of trial. I don't care what your politics are, Trump supporter, Trump hater, it doesn't matter to me, but you support your leadership, and you don't, this isn't a time to bicker and point fingers right now. It's time to get through this. Opinion, just blow those off at every cost. Chris Como is, from what I've read and seen, when I see the actual video clip or read the data, is extremely disingenuous. I usually ignore that. Dr. Fauci is forced, he's forced to beef up security as death threats increase. So as the pandemic continues, Fauci has decided the best move forward for him is to increase some security in certain areas. And we don't know what any of that means until we read the data. And by that time, it's too late. We've been sucked in and we're in a higher state of fear. Trump, again, misleads on ventilator shortage time. I'm pretty sure that there would be no reason for a leader to stand up in front of his people and lie about the availability of equipment. So what does misleading mean? I don't know. I'm not even going to read it. A coronavirus hotspot, small city turns into a coronavirus hotspot. So let's take a look. Let's debunk these things. There are at least 490 confirmed corona cases reported in this county and 29 corona-related deaths. So keep in mind that a corona-related death is not a coronavirus death. Corona-related means that you died and you tested positive for coronavirus. If you showed up to the hospital dying, if you had serious medical conditions and you came into the hospital already in extremis, having a pneumonia, having congestive heart failure, having been on oxygen for the last 10 years because of some pulmonary fibrosis you have from some other issue, or the continued buildup of fluid in your lungs that we can't seem to get off, and you're 85 years old and you're sick and you've smoked your whole life. And I'm not saying this is everybody, I'm saying if that were the case and they came to the hospital and during their 3 or 4 days that they were in intensive care, they died, and at some point during those 3 or 4 days they tested them for coronavirus, it would be a corona-related death. That does not mean they died from coronavirus. All of those deaths for certain did not die exclusively because they had coronavirus, and the coronavirus may not have contributed to their death whatsoever. We just know that they tested for it. So I would like to point out the intentional sensationalism here. So what did we say? This is a hotspot. How 2 funeral homes have helped turn 1 Georgia city into a hotspot. The evil funeral people, they are burying people and having funerals, and this town is now a hotspot of coronavirus, a hotspot with 29 deaths and almost 500 cases out of 1 million cases and 50,000 deaths. Does not a hotspot make? Do not buy in to that kind of crap. Take care of yourself. Take care of your mental well-being. I will be back later today talking about ways to take care of yourselves and things to consider, ways to get better sleep, ways to get better exercise, ways to set some goals, ways to relate to your family and loved ones that you may not spend very much time with under ordinary. Well, I'm bringing experts in for all of these things, and we are going to talk about how we can all get through this. And I am hoping that this is helpful to everyone out there. And we're going to do it every day. We might even do it multiple times per day. And we're going to put it out there. And I'm positive that my network of friends and experts that I will be interviewing are going to provide some value to. If you're wasting time learning about the coronavirus, please come waste time with me and my friends so that you don't come out of this unnecessarily concerned. And we'll take some questions and so forth in the future. But that is all for now. That's 20 minutes, 20 minutes of the exactly 5 minutes I gave myself to do this. Hopefully I'll get better at this. This isn't my job. So hoping you all are doing well, keeping concerns where they belong, and taking care of yourselves and those you love and care about. All right, talk to you soon.